Tonight on Life and Times. Hospice care is meant to comfort dying patients. So why do people wait until their final days to use it?
Here we all hug each other and we show our love. And in the hospital, it's just a business to them. It's a job.
And then, where can you go to see the world's greatest dramas performed by classically trained actors? Why, Glendale, of course, on the stage of A Noise Within. All that and more straight ahead on tonight's Life and Times.
Life and Times is made possible through the generous support of the L.K. Whittier Foundation, dedicated to improving the quality of life by supporting innovative endeavors in the fields of medicine, health, science, and education. And by a generous grant from Jim and Ann Rothenberg.
It can make the end of life more dignified, more comfortable, and more compassionate. So why do so few American families take advantage of hospice care? And why do they wait to the last minute to put a loved one in hospice? Well, it has to do with our doctors, our Medicare policies, and families themselves. Stephanie O'Neill met one family in the Valley that's making some big decisions.
For 94-year-old Marguerite Hirsch, the San Fernando Valley Assisted Living Facility is home. Hirsch, who is in poor health, moved here in November and plans never to leave for a hospital stay, no matter how ill she becomes.
You've been doing really good. You've really improved since the last time I saw you.
Yes.
Yeah, especially in your spirits.
Hirsch, who has a serious heart condition, is among the nearly 1 million terminally ill Americans who annually opt out of traditional medical care and are instead embracing the lesser-known option of hospice.
The goals of care are not for a cure in the physical sense. You don't have the hope of getting better, but you have the hope of having a good life.
Carol Reese is a hospice nurse for Vitas, one of the nation's oldest and largest hospice providers.
We try to diminish or minimize as much as we can the suffering that people endure and make the experience as positive as possible. But if you have decided that you would rather live a normal life without having to be poked and prodded and going into the doctor every day or on a machine for 3 hours a day or permanently, then we're here for you.
Those who choose hospice receive care from teams comprised of nurses who visit as needed, a doctor who oversees care, home health aides who assist in daily tasks like bathing, social workers who provide counseling, and clergy who offer spiritual guidance. Patients like Hirsch are provided basic care at their home, such as medication to ease suffering and pain, but they are not given life-prolonging procedures. However, Reese says the patient can decide at any time to go back to traditional medical care.
I would tell people, you turn over every rock. You have a right to rescind your hospice. There's nothing marrying you to this program. You can change your mind in an instant, and we will refer you back to your doctor and make sure everything is in place. If you come onto hospice and, you hear about something, you can change your mind and come back when you're ready, when you found out that either it worked, wonderful, or it didn't work, and welcome back.
Still, Reese says, many people fear the idea of hospice.
Is there a stigma associated with hospice?
A lot of times, the first thing that people feel uncomfortable with us coming is because here they come, that means I'm dying. Whereas you're living, you're still alive. We're here to help you live. And that is the hardest thing for the families to come to grips with, is to allow themselves to keep on living while they're still alive, and the patients. But it works out really well with the team that we have.
Let's face it, our culture doesn't have a very open and honest attitude towards dying. It's been a taboo subject. Families don't talk about it.
Nancy Griffin is West Coast editor of the American Association of Retired Persons magazine, which is working to improve the availability of hospice care in the United States.
With high technology and the orientation of doctors to always try to extend the lives of their patients, it's very hard for both patients and doctors and their families to find that point where Enough pain has been endured, enough attempts have been made to save the life, and to just say, okay, what we want to do now is to allow the patient to go home and enjoy comfortably the last days or months or weeks of the patient's life.
What's more, in order for a patient to qualify for hospice coverage, 2 doctors must declare they have 6 months or less to live, something many physicians are hesitant to do. That's in part why fewer than half the number of people who qualify for hospice care actually receive it. Instead, a majority of the terminally ill die in hospitals.
There are a number of factors for why it's not larger, which include physician training. Physicians are trained to cure patients rather than to administer palliative care and help them die in a comfortable way. It includes attitudes of families who think that hospice means giving up, and they don't want to let go and admit that the patient is going to die.
Moreover, many Americans remain unaware that both Medicare and most private insurance policies provide full coverage for the service. That was welcome news for Hirsch's daughter, Louise Karras. She says without the service, these last months of her mother's life would be far more difficult for everyone.
I would worry a lot more. I was always worried about her before. Now I know there's someone around that will take care of her. I can go on vacation for a couple days and not worry about her all the time.
So we're like her advocate. We come in, we do her blood pressure every week, we check her medications, we make sure that she's getting her needs met, not just her physical needs, but her emotional needs. Now, the last time I was here, you were wanting to be able to have more independence. Has that happened? Do they pretty much let you get up and walk around as you choose?
Oh, yes.
Okay, so are you happier now?
Yes.
Good, excellent.
Dr. Paul Deal of West Hills says he learned nothing about end-of-life care in medical school. Trained as an internist, he spent the first half of his career working solely to cure patients of their ills. Today, he devotes a large portion of his practice to hospice care.
Did you get a chance to see Dr. Chow?
The ability to have someone, when they're in their last days, to be able to go home, to be what I call in their castle with their things around the people that hold them the dearest, and to be able to do that and support them through the team, I think is an absolute. You know, the idea of going to a hospital to spend your last days, I mean, I'm sorry. I mean, I myself, when I'm at that door, I want to be taken care of just the way that these people are being taken care of through hospice.
Unlike Hirsch, many who qualify for hospice don't get it until they're on the verge of dying. And while hospice can still make them comfortable, patients benefit far more when they enter the program much earlier.
Well, I know I wouldn't get the care or the loving. That's what's important, is the loving. Here we all hug each other, and we show our love. And in the hospital, it's just a business to them. It's a job, the care helpers, and it's once in a while they show a little compassion, but mostly I feel it's their job, and which is good too, but we all need that extra little hug. I love all you girls.
I know, we're lucky.
For Life and Times, I'm Stephanie O'Neill No.
Am I going to have to give you a tissue?
No.
To find out what